Today on This Week Health.
What's the easy button? What can we try that we could get the process and buy-in for? What if there was a button in the bathrooms when they were dirty to press, and it would send an email and SMS to the appropriate parties to let them know that the bathroom needs to be clean? Like most projects, it's the 80-20, right? Most of it was just getting the people and processes aligned, and then the technology was fairly straightforward.
Welcome to This Week Health Community. This is Town Hall, a show hosted by leaders on the front lines with interviews of people making things happen in healthcare with technology. My name is Bill Russell, the creator of This Week Health, a set of channels designed to amplify great thinking to propel healthcare forward. We want to thank our show sponsors, Olive, Rubrik, Trellix, Hillrom, Medigate, and F5 in partnership with Sirius Healthcare for investing in our mission to develop the next generation of health leaders. Now, on to our show.
Hello, I'm Jake Lancaster. I'm an internal medicine physician and the Chief Medical Information Officer for Baptist Memorial Healthcare, based out of Memphis, Tennessee. And today I'm very excited to be with Mark Zhang, the Medical Director for the Digital Innovation Hub and the Associate CMIO for Brigham and Women's. Mark, welcome to the podcast.
Thanks, Jake. It's a pleasure to be here, and I'm thrilled to be invited to this podcast.
And I'm very excited to have Mark on. We've known each other for many years. We met each other when we were both in Clinical Informatics Fellowship. But for the rest of the audience, can you just give them a little bit of your background and tell them what you do?
Sure. So I am an internist by training, then specialized in palliative care, and then specialized again in clinical informatics. And my current role as the medical director of the Digital Innovation Hub at Brigham and Women's and ACMIO at Brigham and Women's for digital innovation. I run a team embedded in IS, within our IS infrastructure, that really focuses on anything digital innovation within the hospital. We do kind of 4 buckets of work. The first is we're a solutions delivery group within the organization. So we're able to build custom developed solutions based on requirements within the hospital or our larger Mass General Brigham umbrella. We also implement innovation projects that are vendor-based. So if there's a vendor that we're looking at that doesn't have a natural home, or we're kind of scoping a pilot, our team is a team that can do that. We do what we call innovation consults, which really help support internal staff members at the Brigham who have ideas any stage, either back of the napkin to ready to spin out. We help them get to the next step. And then we also are a true hub for external companies who want to engage with Brigham and Women's in the digital space. They can reach out to us, and if there's a good connection, or if it makes sense, we make those connections with researchers, scientists, and clinicians at the Brigham, and hopefully we see really great collaborations come from that. And then finally, we're a lighthouse within the organization for digital. So we host events across typically 1 a quarter, where we'll partner with a community-based group like Mass Challenge, or a more national group like Y Combinator or other vendors, to host events kind of highlighting our engagement with the digital community. So that's kind of the work we do at the iHub and my role.
Very nice. And if I remember correctly, even in fellowship, you were doing some work in innovation. Can you tell us just a little bit about that past experience and how it prepared you and led you to this role?
Sure. So I actually didn't even know what informatics was until I was a palliative care fellow. I did my residency. It was a lot of this, like most things, is about timing and luck and maybe a little bit of skill. And I think for me, it was good timing and great luck. I did my residency in Pittsburgh at Allegheny General right around the time the iPhone had been announced, a couple of years before, and the App Store was coming out, right when I was an intern. And I remember when I was a 4th-year medical student, seeing the first iPhone. For me, I think one of the interns had one, and I remember looking at my old Palm Trio and thinking, man, the game has changed, that's the future. So when I was an intern and the App Store came out, I don't have a technical background, but I knew that knowing that that's where things were going, I wanted to do something with digital and healthcare. And really learned a lot during my residency, finding interdisciplinary teams of programmers and others to build kind of clinical applications for iOS and then eventually Android. And then when I found my clinical niche, which is palliative care, I also knew I wanted to go to a place where there would be more opportunities. The community and the environment was just a little bit more, I would say, connected than Pittsburgh, which again is an incredible city. They have all the pieces, but back in 2010, maybe they didn't connect as well. I think now they probably do. So I was really fortunate to go to Boston for fellowship at MGH Dana-Farber in palliative. And during that time, I used my nights and weekends to kind of connect and network with the innovation community, did some hackathons. I won a couple of hackathons and ultimately created a company and spun that out into a venture-backed thing, which still exists. And it was actually, when I was a palliative fellow, I was kind of known as the fellow in the group who did apps. In fact, like for holidays, we all got Christmas, like holiday mugs with like something personalized. And mine said, "This mug is an app," which I think was like chef's kiss. So I was on service with one of my attendings who now is a good friend. And he saw a flyer for this new fellowship that was coming out at the Brigham called Clinical Informatics. And he gave it to me and he went, "Hey, Mark, this is something that it seems like you would be really interested." Like the undertone was, "You're like a big nerd. You should like look at this." And I did. And I was like, you know what? Actually, I do want to do this.
Yeah.
So I reached out to the program director and to see if I could do an elective. We got to talking and he was like, "You should just apply." And I did, and became the first clinical informatics fellow in the program. Really the goal was to try and figure out how to build these digital tools within an AMC. A lot of the work I did prior to that was really resulting in me not being able to figure out how to get it done in the confines of like an AMC or
Right.
within a hospital system. It's just, I just kept on running into kind of walls. So like, well, how I solved that was just going out of the hospital system, finding others and other groups, just doing it outside of my normal day-to-day. So fellowship was a lot of learning how to build these kind of solutions and do kind of become an intrapreneur of sorts. And to that end, after my fellowship, I stayed on at the Brigham to effectively do that, to build apps and help with innovation. And then when this gig came up, I was really fortunate to be able to take it on.
Yeah, that's really great, particularly when you're talking about how to build it within the confines of an academic medical center or hospital. I know we still struggle with this. I'm sure everybody still struggles with it. Can you tell us just a little bit about how y'all have addressed some of those challenges with building things internally and maintaining it, particularly is some of the challenges long term?
Maintaining that's yep. So I think like one of the things that we do at the iHub is, as I said, we're a solutions delivery group, but we're also kind of a support structure and almost like a mentor for anyone at the Brigham who has an idea in digital health. And for the solutions delivery, it's pretty straightforward. It's a top-down approach. So really, we don't build the thing unless leadership sees the problem and asks to build the thing. And typically, when we do that, we'll use fairly standard kind of processes to help ideally figure out like, okay, who's going to do what, right? Like who's going to maintain this thing for how long and da 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 da. Is this a build or a buy? We kind of come, either that's already pre-decided before it comes to us, or that's like the first part of work is like creating eventually the charter for this type of work, and then hopefully we maintain it. So during COVID, like I think most groups, because everything was so aligned, everyone was so aligned, we were able to do a lot of really incredible kind of system level interventions very quickly. So one of the things that my team kind of created and continued to maintain is our daily symptom attestation tool at Brigham and Women's, but also at Mass General, Brigham, Dana-Farber, and actually I think other sites use it outside of our system, called COVID Pass. And that was something that is a perfect example of a custom developed application that, because we had that alignment from the beginning, we were able to rapidly create the solution, develop it, iterate on it, and then also, as part of that, have a maintenance plan moving forward. The maintenance plan was my team and other teams who played a substantial role in building the thing. We continue to maintain it in an agile format. We have like biweekly sprints, and it's been a blast. On the other end of that is when we support kind of Brigham innovators who have like really early stage ideas. A lot of the work we do is really making sure that it's a lot of education, right? Like, folks are typically incredibly talented, incredibly smart folks who might not have as much experience or in digital or doing anything in digital. So a lot of what we do at the initial stages is just understand what they're trying to solve, talk about some kind of base concepts like what is an MVP. And then we also have a framework at the iHub, which we call the COFT model, which is really something that we do, particularly when it comes to like a digital intervention that like the researcher or clinician wants to ultimately try and pilot or implement within the hospital system. And we run through it to kind of get a sense of like how ready they are. It's like a readiness scale to actually do the thing. So C is like, who's the clinical champion? And if you don't identify, if you're not the clinical champion, or maybe if you are, how much time and effort do they have dedicated to do this thing, right? And would they be the person that would also maintain the pilot or maintain this thing? O is who's the operational champion. So that could be, does your superior, your chair, is there buy-in? Is this a problem for you, or is this a problem for your department? To actually implement the thing, do you need assistance? Like, do you need actual implementors to do it? F is pretty obvious. It's funding, right? Is there any funding for this? I mean, if not, that's okay. Then clearly the next step is like, we need to refine the proposal in a way where we can get you set up for funding, or try and do as much as we can without funding to kind of get you to like some kind of either functional or at least conceptual MVP. And then I think the other really important piece, which really only works because we're aligned with our IS, we're part of the IS group at Brigham, is the T, which is what is the technology alignment with our current stack, right? Like, our group and our job, I feel strongly, is not to be like the tech cops and just say no to things. It's more to make people aware when they want to do a solution that already exists within our EHR kind of functionality, or already exists in an enterprise like software package that we already use. We want to show them like, look, this already exists. Maybe you should use it. And maybe if they still want to do it for research or what have you, it's about making sure there are guardrails. So the expectations are set at the beginning that, look, you can do this for research, but because this exists, there really isn't a pathway to like move this into enterprise. So like, let's understand that from the get-go, so we're all on the same page.
That's great. No, that's really helpful to understand kind of y'all's processes. And you talked a little bit about the intake, about some things they'll come to you as we've decided we're going to build this instead of buy it and turn it over to your team. But tell us a little bit more about the governance, about how projects come to your group. Once you're done with them, do you spin them off? Do you keep them internally to maintain? How does that work?
Yeah. So I tend to think about, specifically at the iHub, we have essentially two bosses, right? The first boss is the Brigham and MGB. So those are like the top-down requests where there's an ask to do X, Y, Z, and it's coming from executive leadership, and we have to do it. We have to figure out a way to do it or accommodate it. Our second boss are all staff, anyone that works at the Brigham through that innovation consult perspective, right? And typically it's that request is, I have an idea or I have a project and I wanted to get to the next step, or I need some assistance, or my project is like going great or it's stuck. How can you help? So the governance from the top down is pretty straightforward, right? Like, if it's coming from the top down, we'll work through the existing committees and pathways depending on the project, in working with kind of our leadership as well. If it's coming from the bottom up, a lot of this is about supporting whatever the idea or the project is to get to the next step. And sometimes the next step is that, hey, you know what, maybe this is ready to be scaled at larger than just a pilot. And then from there, we work with our colleagues in kind of our central MGB innovation group. There's a mechanism we use to help kind of scale these projects. So that's kind of the governance set for things that come from the bottom up.
Nice. You talked a little bit about COVID past, but tell me about some other projects that you're proud of. I remember hearing you give a talk about a button that you would put in a bathroom that patients could hit to clean the bathroom. I thought that was really innovative.
Yeah. So this was like maybe 3 or 4 years ago. This is a perfect example. Actually, it's funny, we're actually doing like version 2 of this now. So that was actually an example of an innovation consult, like an internal innovator who already had a relationship and was interested in doing. Dr. Peter Chai, toxicologist and just an incredible innovator, already was interested in doing work with these IoT buttons and had a relationship with a company that kind of created some software to help make them more of an enterprise solution. And this was actually, if you remember, the Amazon Dash buttons.
Yeah.
This was like 3-4 years ago, and we were looking for kind of use cases for them in the hospital. And the use case that we saw was, what's the easy button? What could we try that we could get the process and buy-in for? And we ended up doing it for kind of things like to flag when like a bathroom needs to be clean, or when wheelchairs need to be refilled. Kind of like the use case that the dash buttons were originally intended for as the consumer to like refill your Tide. Well, the wheelchair bank needs to be refilled. What if there was an easy button that we could program to alert the transport group to refill the wheelchairs? Or what if there was a button in the bathrooms when they were dirty to press, and it would send an email and SMS to the appropriate parties to let them know that the bathroom needs to be clean. Like most projects, most of the work, it's the 80-20, right? Most of it was just getting the people and processes aligned. And then the technology was fairly straightforward. That was actually, so we published a couple pieces on that, our proposal and then our initial results. And afterwards, it was a QI study. Afterwards, actually, it was so successful that like groups just wanted to use it moving forward, and they kept on using it until the batteries actually died, and the company that supported the whole solution like no longer supported the solution. So actually, more recently, we're doing this really interesting, very early pilot where one of the things that we saw with COVID is that people just as a whole are way more used to using QR codes. There was always like this tension using QR codes in the past about, do people actually know how, I think technologically savvy people, of course, know how to use a QR code, but like, is that the case for everyone else? And it was unclear. Well, now I think we're all pretty familiar with QR codes just with our day-to-day life. So we actually are replicating the IoT button work. We have this other project that the iHub built. It's another solution called Brigham at its Best. And it was actually a project I started when I was a fellow called Fix It, which was kind of a similar, I like 95% of my career so far, Jake, has been, how do I like work with environmental services to give them more work?
But I thought it was going to be coming up with names for your projects.
Well, that's how I know when things actually are super successful. I lose naming rights when things are successful, and then someone else gets to name them. So Fix It was what I initially called it, but then when it actually got good, the name changed to Brigham at its Best, which is a fine name. But it was basically a digital version of the easy button. So now we're actually creating a new version using QR codes that are linked. So these are hard-coded fix-it requests to a QR code. So you can just put up we put up a pilot on one of our floors where we have a sign that anyone can just scan the QR code, and it automatically brings you to a pre-filled web form that like says central transport needed to clear this hallway. And there's a form to fill in more details as needed. And we've actually created a really nice way to close the loop for central transport using the same QR code. And what we're seeing is that the engagement there is pretty incredible, and people really like it. In fact, they're requesting. Another good sign when these things are going forward is, who are your stakeholders requesting that these things get scaled further. And this one so far, we've seen that, which is great. So
no, I mean, I can definitely think of a lot of applications for that, where if a computer's broken or something's broken on a computer, instead of having them call the help desk and go through that, you could have the QR code that just sends straight to them.
QR code, and actually, I think it's the QR code, but importantly, it's the platform we had already built to like ingest these fix-it requests and the process. Like this is stuff, it's all iterative, right? We built this initial thing back when I was a second-year fellow, which was a really straightforward web form that we linked to email and SMS, and we got the stakeholders in environmental services to like kind of look at and respond to. And that's kind of expanded to become this whole platform called Brigham at its Best, which not only enables you to do send out fix-it requests, but also is like an employee hub for your real-time shuttle tracking, what's the menu at the cafeteria, resources, and bundled into a progressive web application kind of as a tool. So these are kind of some of the things that I would say are part of our solutions delivery arm of the iHub.
Well, Mark, it's been great talking with you and catching up. For the audience, can you give them just one or two things that you're optimistic about in the next few years with the Innovation Hub?
Yeah, I think that we've been around for almost a decade now. We started in 2013. 2023 will mark 10 years of digital innovation. And I think that I've actually been a part of it since I was a palliative care fellow. I've been around MGB for about 8 of those 10 years. So I was there pretty early. And I actually saw the iHub as a customer first, as a fellow, and then as a clinical informatics fellow, and then kind of eventually taking on the leadership of the group. And I think what I've seen is that it's still early days for digital innovation. And also, how do you do it within the confines of an academic medical center? And I think what we're trying to do, and we continue to do, is create processes and frameworks to make this reproducible, and also ideally to make it something that isn't just innovation theater, but really is connected with the true kind of operations and needs, both our customers, so Brigham and also Brigham MGB, and also the staff. So I'm really excited actually to see how this continues to move forward and how we kind of build this out. So one of the things, this is probably more than a couple minutes, but just one last thing. One of the things we're really moving towards is how do digital innovation centers like the iHub really become subject matter experts in like these new fields that are emerging. So things like Web3 or VR, AR, things like that, digital prescription therapies. How do we become a true SME, and how do we, and there's clear value to that within our organization. How do we track that we are the SME, and how do we kind of keep track of that and support that within the organization, and still also importantly be the lighthouse, so that outside parties know that this stuff is happening within the hospitals, and we're here to support that. So that's the stuff that I'm super excited to work on moving forward.
Well, thanks. That sounds amazing. And I would love to hear more in the future. And thank you, everybody, for listening. Have a great day.
Yeah, thanks so much.
I love this show. I love hearing from people on the front lines. I love hearing from these leaders. And we want to thank our hosts who continue to support the community by developing this great content. We also want to thank our show sponsors, Olive, Rubrik, Trellix, Hillrom, Medigate, and F5 in partnership with Sirius Healthcare for investing in our mission to develop the next generation of health leaders. If you want to support the show, let someone know about our shows. They all start with This Week Health, and you can find them wherever you listen to podcasts. Keynote, Town Hall, Newsroom, and Academy. Check them out today, and thanks for listening. That's all for now.